Greetings. This is Justin Allen, the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system, and frankly, screw that. Sick of it, and it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take the measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Hello, everyone. Today we'll be talking to Megan and Jamison, who are wanting to start a mental health clinic. Megan is a psych nurse practitioner, and Jamison is her husband, who will be her practice manager. Megan is currently working full-time in a community-based mental health clinic, and Jamison works as a medical device salesman. They are wanting to start a psych practice where they will focus on providing outpatient psychiatric services. They are needing assistance with narrowing down their services, general startup advice, and steps on how to start this practice with an aim for future growth. Hey, Megan and Jamison, how are you?
Great. How are you?
I'm good. How about you, Jamison?
Good. Thanks.
Good.
I appreciate
Okay.
this time.
Cool. For sure. So, like I mentioned before we started recording, with two people, we don't want to talk over each other. So Megan will answer first, and then Jamison will answer after her. Just FYI for anyone listening to this. So anyway, let's go ahead and get started. So tell us a little bit about yourselves. So Megan, you start off first. So how long have you been a psych NP for, and kind of, what things you've been doing?
Sure. Yeah. So I've been a psych nurse practitioner for 2.5 years. Prior to that, I was a registered nurse in med-surg since 2004. Currently, I work at a busy community-based mental health clinic doing outpatient psychiatry. I also help to run the respite clinic there. I cover urgent psychopharm and help mentor other new nurse practitioners. So it's a lot of roles in that, but yeah, that's what I'm doing now.
Cool. Wow. Well, good for you. So you're seeing patients, you're doing a little administrative stuff, plus mentoring students and precepting then.
Yep. Correct. Yeah.
Yeah. Cool. Awesome. Okay. And Jamison, what about you?
Yeah, I work for a major medical manufacturer, so I cover a large portion of the country and just sell medical equipment to hospitals, and just kind of watching my wife go through this process, and I've kind of opened up. We've had a couple of little companies we've owned and into some real estate and different things. It doesn't look anything too hard to handle, but learning the process, going through it. I just finished getting my MBA, so I feel like I think I can help her to establish a practice for her and maybe even for our kids and our community.
Yeah. Sure. Okay. So you guys have both started a business before?
Correct. Yes. We started a small business that was really successful, and we sold it about 2 years ago, maybe. We ran it for 10 years, sold it 2 years ago. It just kind of ran its course.
Good for you guys. What was it?
It was a bounce house company. It was I say it now and I laugh.
Well, I like to say,
but it met the need at the time when I was the time that we had it. We have 4 sons, and they were very small at the time. And so I worked per diem as a nurse and kept my pinky toe in the door nursing. And then we needed something to help supplement the income. And my husband is very entrepreneurial. So we started this literally out of the back of our minivan, and it grew to a really successful company. He did a great job with it. And we partnered together to do that. And then when I went back and got my master's in nursing, it kind of ran its course and we just sold it.
Good for you guys. If you don't mind, I mean, I'm always interested in selling businesses. I mean, I've sold a couple myself, and so I was kind of a little off topic here, but I mean, what was the general kind of estimate of the valuation of that business? I'm curious.
Yeah, I'm going to let my husband answer that one.
Yeah, I mean, it's such a niche business, which is
Yeah.
part of the problem. There's not a lot of buyers for it. So I did shop it a little while. I kind of thought this would be a, $300,000, three times earnings, something like that, two times earnings, but it didn't pan out that way. And we actually sold during the pandemic. The pandemic happened, and we got squashed. No one could do parties, and the state that we live in is very abusive to small businesses, I think. And so we honestly just tried to sell it to friends, family for a little bit, and then we ended up finding a guy, and we did owner financing.
Oh, okay.
So
Okay, cool.
it didn't do great, but enough, made six figures. But I
Hey,
obviously wanted more, but it is
yeah.
what it is.
Yeah.
Yeah. Okay, good for you guys. Yeah, I sold a portion of my men's health clinic, and I
Mm,
owner financed it as well. So
mm,
it's a nice little monthly payment, right? For the next five
That's
yeah.
right.
years, I'll be paid, a certain amount of money, and that
Yep.
person will end up owning a portion of it. It's basically my office manager. And so yeah, yeah. All right, well, good for you guys. So what I'm getting here then is that you guys probably have some money set aside to invest in this business. Like financially speaking, you guys should be okay.
Yep.
Correct.
Yeah, yeah. Okay, good. Okay. So what do you guys want to do here? I know, Megan, you said that you wanted to do kind of just general psych, right?
Yeah. For now, I think starting a psych practice, to be honest, it feels a little intimidating to get out there on my own and do something. I feel really inspired by you and all the other nurses that are out there on your podcast sharing this, that, well, it can be done. My intention towards it is to be able to help people. There's a great need in our community, as I know there is across the country, for mental health services. And so I'd like to get out there and be able to help people in my area, specifically also with trauma. I can't do a lot of therapy where I'm at. I'm specifically med management, every 20 to 30-minute appointment, follow-up appointments, so to speak. So that's kind of my intentions, is wanting to help more people. Sometimes I think about, could I add an ADHD clinic along with it? Sometimes I think about branching out, and one of my questions for you is, can psych NPs actually practice functional integrative medicine, or does that really fall out of the scope of practice for me? Something that I know I could look into my nursing board for, but
Sure, sure.
yeah,
Okay, so a little bit to unpack there. So you're going to start off with just general psych services then, right? Like,
correct. Yes,
yeah,
yeah.
okay,
Depression, anxiety, ADHD. Yes, correct.
all those things, right? Okay. Are you going to be insurance or cash?
Insurance.
In-
I am already getting credentialed through Headway.
Okay, so you're going to be credentialed with multiple entities, Blue Cross, Cigna, et cetera, et cetera, et cetera. So yeah. Okay. What's the population like? Your patient population? Are we looking at a lot of just Medicaid, Medicare kind of patients, or are you going to be doing a lot of private insurance?
No, there's enough private insurance out here. We live in an area, I mean, the two counties alone are about 700,000 people where we live. So there's enough people. And I think there's enough with private insurance that we could do okay.
Okay.
I was curious. I was going to put that question out there. I don't know what it's like to have Medicare, having the state involved in your practice. So if I
Yeah.
were to accept Medicare or Medicaid, what does that look like when the state comes in? I'm sure they have very high standards and different things. I'm not sure if that's wise or
Well,
not.
well, it depends on how lazy or how motivated the state auditor inspector is.
Got it.
you
Oh,
know,
okay. Yeah.
yeah, I mean, you're dealing with government workers, right? Most of them,
Mm,
they're not accountable to anyone, and they're
mm,
generally
mm,
lazy, or they can really make your life a pain in the ass, right?
yeah.
So, yeah. So with that said, if you don't have to see Medicaid or Medicare patients, I would highly advise doing so, because, you're inviting the government in your business, right?
Right.
Yeah, that's just me personally. It doesn't settle well with me. I pay the government enough money in taxes every year. I have to deal with enough regulations in my
Mm,
life.
mhm.
I don't want my business to be now regulated as well, right? So, so
Right.
yeah. So just kind of keep that in mind. Eh, I would advise just avoiding it if you can. Okay.
Yeah. Yeah,
Um,
I'm with you.
yeah. Some states, though, I've noticed, they'll require the nurse practitioner to basically see Medicaid and Medicare patients if you're being credentialed. So, like for example, like Blue Cross Blue Shield will not credential you. You will not be able to see private insurance patients unless you also accept Medicaid as well.
Oh, wow. I didn't know
Yeah.
that.
Yeah, that's gonna
Gotcha.
be dependent on the state. All right. I
Okay.
don't know. I don't know about your state. You're basically, the person credentialing you will know that answer. Okay.
Okay.
Yeah.
Look
But
at
like in my state, you have like if you're a nurse practitioner and you're getting credentialed with Medicare or not Medicare, Blue Cross Blue Shield, Cigna, United Health, whatever it is, they will make you see Medicaid patients as well. So
wow. Okay.
yeah,
That's
yeah.
yeah, I'll definitely look into that.
Yeah, yeah. So look into that, but yeah, but if you can avoid it, I would say avoid it. Okay.
Yeah.
Um, Now with that in mind though, also consider, with insurance though, you might not have the government in your business with Medicare and Medicaid, but you still, you do have a third party in your
Mm,
business, right?
mm, right.
Yeah, you have this outside company now, monitoring what you do. They can kind of tell you how to practice if you want to get paid. They can audit you, they can take their money back whenever they want to.
Mm,
So keep that in mind too. If you start a business, and you accept insurance, you're never really going to truly be free. This isn't, a bouncy house business where you charge cash and that's it. And there's no one else, you know, breathing
right.
down your neck here, right? Yeah. So
Yeah.
that could be a different pace of change. Maybe not necessarily for you, since you're, basically you're seeing insurance patients already at your practice anyways. But like Jameson, for example, like it's going to be a kind of a big change for you from the business aspect. Like, you have this third party and control your money basically.
Yeah,
So
I'm psyched. It's super exciting.
yeah, super exciting, right? Yeah.
Hey,
Yeah.
I did hear one of your podcasts, if I could share here, where you didn't want to commingle, or someone was doing it where they took cash and insurance, and I understand that, the bookkeeping of that, and even the legality of that, and commingling funds. But I wondered if there was an opportunity to, phase one is setting up her practice, but phase two, having more of that, mental health and wellness clinic, where if we did have a therapist under us or someone that had MSW, where we could do cash on the side, but have a separate LLC. I mean, have you seen people have an insurance billing aspect of the company and then a side separate LLC, even if I put it in a holding company in Wyoming and all that jazz,
Yeah.
kept it separate to cash payments?
100%. You can legally do that.
Yeah.
Okay. Yeah. Yeah. I mean, you just have to have two separate entities and two separate everything, basically, a lot of people will have two separate entities for their cash practice and then their insurance practice. And it's like they're sharing the same bank account and all this stuff. No, 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 no.
Mhm.
It has to be a separate thing. You know what I mean?
Yep.
Okay.
So yeah, so you can't do that. Or if you are only operating under one entity and that's accepting insurance, you can still charge cash for stuff that's non-covered. Okay.
Mm,
So, Megan, when you asked about, functional integrative medicine, or functional integrative psych,
yep.
if you're prescribing someone, let's say, leothyronin or levothyroxine or whatever for subclinical hypothyroidism, and
Mhm,
you think that their depression or anxiety might be stemming from that,
mhm,
um, insurance isn't going to pay for that medication, right?
mm,
Because they don't have clinical guideline hypothyroidism, right?
got
So you would then charge cash for that. Maybe, you could charge cash for that medication through a compounding pharmacy, for example, and the patient would have to pay you cash for that because their insurance isn't going to cover it. It's a non-covered service. Does that make sense?
yes,
Yeah.
100%.
Yeah. So you could do that. If you're a psych, you are psych NP only, right? You're not family or anything.
Just like,
Just psych. Okay. So, this will vary state by state, but in general, this is what I tell psych NPs. This seems to be kind of the rule of thumb in most states is that
Mhm.
you can see patients for a variety of different things, IV infusion, vitamins, hormone replacement therapy, even weight loss, as long as you're seeing that patient for a mental health issue, right?
Okay.
So if you're prescribing someone, let's just say semaglutide for weight loss, you're not prescribing that for obesity or weight loss. You're prescribing that for their depression that is secondary to their obesity.
Mm.
Right.
Mm.
Right. Yeah.
Yeah.
Yeah. So you could do that,
Okay.
or, you prescribe a man testosterone replacement therapy because you truly think his depression is stemming from his low libido because his testosterone is 250.
Mm.
Right.
Mhm.
So, like,
Yeah.
why give someone, bupropion when you could treat the underlying problem? Right. That's functional medicine.
Got it. Yes. And
Right.
that's interesting. What I'm hearing you say is that it falls under my scope of practice as long as it's done under the name of a mental health diagnosis versus a medical diagnosis.
Correct. Exactly. That's exactly
Okay.
right. Yeah.
Yeah.
So you can't like sit there and market new weight loss clinic open and then you're just diagnosing everyone with depression. I mean, you know,
Right.
like, yeah, like I would be cautious about that. You know what I mean? So you have to be a little clever in terms of how you market it and what the public perception is on it. Does that make sense?
Sure.
Yeah.
Yeah.
100%. And I
Yeah.
think that if that was my idea of calling, it's a behavioral health and wellness clinic.
Yes.
So that way you're coming in under the name of a mental health challenge. And then the wellness is provided through those other services that you were just talking about.
100%. You could do that. No problem whatsoever. Yeah.
Okay. Yeah.
I would
Yeah.
say maybe like, I don't know if I would say mental health and wellness clinic. I think I would probably go as far as saying like, integrative psychiatric care and wellness or something,
Yeah.
that way you can kind of go the more integrative functional route, like right from the start, because there's a lot of people out there that, they're looking for people that do that.
Yeah.
Yeah.
No, you're right. You're exactly. It's funny that you say that because I've been going back and forth on the name and I've been doing little surveys to different people about the name. If I called it this versus that, what would you lean towards? And in the industry, it's called behavioral health. So, but when I'm polling the general population, they don't understand what behavioral health is. That means nothing.
No, it doesn't. And
Yeah.
yeah, I wouldn't call it behavioral health. I don't like that name because it's like, I think in my opinion, there's a difference between behavioral health and mental health.
Yep.
Like behavioral, like you're teaching people who have bad behaviors, like you're teaching them,
Exactly.
right, adequate behaviors, like they don't know how to pay a bill,
Right.
right?
Right.
Like these childlike behaviors, there's a difference between that and having, anxiety.
Absolutely, absolutely, and that's where I was going back and forth with the what I call the clinic. Not that it's a huge deal, but to your point, that's exactly what the when I would ask my friends or family, "Hey, what about the behavioral health clinic?" They're like, "I would never go to that because it sounds like something for people with behavior problems."
Right.
Even though that's the industry name for psychiatric care, which I don't know where that came from, but here we are.
Yeah.
So, I like that name though, the integrative psychiatric and care, integrative, that way it sounds more of what it's psychiatric care,
And
um,
wellness. Just put
and
an and
wellness
wellness behind that. You know
and
what I
well.
mean?
Yeah,
That
yeah.
way, yeah, that way from a marketing standpoint, SEO standpoint, and stuff online, people will see integrative psychiatric care. Okay, great. I know what they
Mm,
do. And then
mm,
and wellness. Oh,
mm.
okay. You know what I mean?
Yeah, yeah, exactly. And
Yeah.
it does that when you do integrative psychiatric care, is that an extra step of education that I would need when I say integrative psychiatric care, or do you think
No.
that what I'm do on a day-to-day basis is that.
No, there's no board certification for that.
Yeah. Okay.
Like
Yeah.
there's no license for that.
Yeah.
There's a variety of functional medicine schools online and integrative health, institutes and stuff. And they like to package up their program and make it sound all fancy and
Mhm.
elitist by saying you'll be board certified after, you take this exam that we also created, and you're going to also pay us another $5,000 to take that exam. It's bullshit.
Got
It's
it.
just a marketing gimmick. There's no such thing as board certified in functional medicine. Doesn't exist.
Mhm. That's
Okay.
helpful.
So, yeah.
That's helpful.
Yeah. So be very careful. Like I have people email me all the time, does your functional medicine course provide board certification? I'm like, there's no such thing as board certification. And if anyone's telling you that, they're trying to take your money.
Hmm.
Yeah.
Okay. Really good.
So, yeah. So as long as you could take some courses, take some continuing education, and you can show the board, let's say, for example, the board of nursing, I don't know, for some reason, they don't like what you're doing or something. As long as you
Mm.
can show them that you have official continuing education credits and you've taken advanced education courses over those things, then you'll be fine.
Cool.
Yeah.
That's helpful.
Same thing. And yeah, and that applies to malpractice as well. Like the last thing
Mm.
you want to do is get sued for,
Thank
let's
you.
just, yeah, for example, you get sued for prescribing one of these off-label treatments or something, and the malpractice says, "Hey, we're not going to cover you, but if you have training behind it, then you'll be okay."
Yeah, no, that's one of my fears, opening my own practice, is getting sued. We do have general malpractice and then an umbrella policy and other things, and we're putting it in an LLC, et cetera. But how do you not get sued? I mean, besides, I'm a judicious practitioner. I know good practice, but
Right.
outside of that, anything I should be
Yeah.
looking for?
Yeah. I mean, I've talked to a lot of lawyers. We had Joe Flores actually come to the Elite MP conference, and he kind of talked about it as well.
Mm.
The big thing is just obviously avoid patient harm to begin with, right? I mean, it's
Mm.
just a no-brainer. Like, don't hurt your patient. You don't got to worry about it, right?
Yep.
But the problem is, though, is that you and me know, and anyone listening to this knows that oftentimes malpractice or a poor patient outcome is sometimes just completely out of your hands, and that outcome was going to happen anyways. You know what I mean?
Mhm.
You
Mhm.
just happen to have seen the patient last, and some smart ass lawyer now is going to try to put the blame on you, right?
Yeah.
It's the Russian roulette of medicine. It's like whoever saw that patient, whoever pulled that chart was going to get sued. It doesn't matter what you did, you know?
Mm.
So an example for that would be, I don't know, someone, you prescribe someone testosterone replacement therapy and, God forbid they develop prostate cancer, they have a heart attack. Chances are they were probably, they were going to have that heart attack or the prostate cancer anyways. But
Yep.
some smart ass lawyer now is going to, say that it was your fault. Right. So with that, you just have to have the patient sign informed consent. Right. You have to make sure that they understand the risks and the benefits of it. You document it as well outside of the informed consent. So, you have a rock solid informed consent that, states the risks, the side effects, the benefits of whatever you're going to prescribe, as an off-label option, for example. They sign that, they understand that, and then you also document that you had a conversation with the patient, going over it again. If you do that, you should be covered, right? Like they were aware that that wasn't the only treatment option. I think that's critically important. If
Mm.
a patient thinks that testosterone replacement therapy is the only treatment for their depression, and then something happens, then, it's going to be pretty hard to argue that. So you also have to make sure you document that, alternative treatment options were discussed as well,
Mhm. Mhm.
right? Yeah.
Yep.
Yeah. So if you document these things, don't worry too much about it. And if you haven't signed an indemnification clause that are, they're indemnifying you of any harm or whatever too, that's going to help. So if you do these things, I don't think I'd lose too much sleep over it.
Okay.
Yeah.
Yeah, that's helpful.
Yeah.
To just make sure that there's a rock solid, uh, informed consent and having a legal team, so to speak, look over all the consents that I would put out there.
You
And
can. You can. I mean, if it's gonna help you sleep better at night, you can definitely have, a lawyer review this stuff if you want. Um, all the consents that come with our courses, I've had countless people say that, my lawyer reviewed this and said it was fantastic and they didn't recommend any changes whatsoever. So,
okay,
yeah, so if you do take one of our courses and you use the consents with that, you should be pretty good there. You might want to maybe add a couple things that are a little bit more specific to what you're doing in it. You know what I mean? So, the more you have in the consent, the better.
got it.
Yeah,
Okay, that's
yeah.
really helpful. Thank you. Yeah.
Was it Headway or Charm that offered the consents? Remember, she had a whole library. I think it was Charm.
Mm.
So we're using Charm as an EMR, which I have 1,000 questions about as well. But they have almost like a library, like a user library of all different types of forms that you can use that they say are vetted. Would you recommend, or would you think that'd be a good idea to just grab those, the ones that we think are best, look them through, add, like you said, add, and then send it off to an attorney for final review?
Yeah, for sure, because that's going to save you money. If you have a lawyer draft something from scratch, they're going to charge, an arm and a leg for it.
Yeah. Yeah.
Yeah. And, at the end of the day, all a lawyer's going to do is just take something that they already had pre-made, and just add your stuff to it, spend 30 minutes on it and charge you for 5 hours of work. You know what I mean?
That's true.
Okay.
Yeah. So, for sure. But the thing is, in consent forms that are with Charm EHR, they're probably going to be a lot standard medicine kind of based stuff, maybe not the integrative stuff. So, keep that in mind.
Mm, that is helpful. Yeah,
Yeah.
there's specific design just for make sure it's geared towards integrative pieces.
Right. Like if you take one of our HRT courses, for example, you'll have all the consents that you need. And so then you could just use that and integrate it into maybe one of those other Charm EHR ones or whatever. And you should be good.
Okay.
Yeah.
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 Good idea.
So yeah, so like I said, don't lose too much sleep over it. Just get a good consent form. Make sure each patient is signing it, and yeah, and you should be okay. I would probably have the patient sign it every 2 years as well, so they're just have a nice reminder, and make sure that you document each time that you see them, that you always discuss the risks and the benefits of the treatment with them.
Okay. All right.
Yeah, yeah,
And document.
so,
Mhm.
yep, exactly, document it.
Yep. That's helpful.
Yeah,
That's
for
helpful.
sure. So,
Go ahead.
yeah, any other questions in terms of that goes?
Not that I would probably pivot to a couple different.
Yeah.
Do you want to talk? So right now we're thinking about, we've signed up with Headway, so I'd love your feedback on that, and also Charm to be the EMR. It seemed like Headway, it was Headway or Alma or whatever it's called, Alma. Seemed like a good start to get into business where they credential you and they do all the billings. You don't have to worry about that and get your schedule. And it's kind of a nice way to ease into it from my, little research. But do you recommend Headway and Charm? Have you worked with other people that have used that before?
I mean, I've talked to other people who've used it. I never have personally. I just cash only basically. That's the only kind of practice I run. So I personally haven't had any experience with them, but I mean others have. It's hit or miss. Like some people love it and some people can't stand it. It really just depends on what the outcome ends up being with you. Like so I've heard from some people that they've done a fantastic job credentialing them. They've done a fantastic job billing. They get their payments on time. They handle audits, et cetera, et cetera. And then I've heard from other people too that it's been an absolute nightmare. They are not submitting my codes on time. I haven't been paid. Blah 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 blah. Right. So it's it's just like any other service, right?
Okay.
Yeah. So, my advice for you is be very cautious on what you are signing with these people. Are you credentialed as the entity, and do you own that credentialing? Or is it strictly through them? So like if you part ways with them, are you still going to be able to bill insurance now, or are you going to have to start the credentialing process all over again?
I think we already know that.
Hmm.
Yeah, no, that was something we talked about earlier. They are credentialing her. So if she were to leave and go elsewhere, you're absolutely right. She would need to re-credential. And that's just
So
it.
okay, well, yeah, but when you bill insurance through your own business, you have to credential your entity. So are they credentialing your entity, or are they just credentialing you, Megan, and they're billing through Headway?
Yeah,
That's right.
that's a really good question. I just
There's
was
no
looking
entity.
I just was looking into that because there's the NPI versus the NPI-2. Do you know about that? Where you have
Yeah.
to
So you have a group NPI. Do you have a group NPI for your entity?
not yet because
So not
I'm
set up.
barely even an entity. I don't think I'm an entity.
So when did they start credentialing you?
About a month ago.
Okay, so if they started credentialing you before you even had your entity, then that's going to be our answer. They're credentialing you as a sole provider, probably under their group NPI.
Yes,
Yes, that's
correct.
exactly what they're doing.
Which
Which
is
Okay.
why
I
you're
yes, yes.
So that means you don't own that. So if something happens between you and Headway, you're shit out of luck. Like you have to wait 6 months to start to bill insurance after that if you part ways with them, because then
Mm,
you're gonna get recredentialed. Your entity will.
mm. So
See,
I'm just
yeah,
wondering out loud right now, is there a way for me so Headway's credentialing, and then once I get my entity up and running in 2024, should I go back through and re-credential myself just so that I have that running in the background?
100%.
Okay. All right. That's good. Yeah.
Yes, you have a third party in control of your money. So
Mm,
not only do you have insurance now, you also have this middleman you have to worry about. This is not freedom.
mm,
Could you do it simultaneously as she's getting ramped up here with Headway? She starts seeing a couple patients as we slowly get into it. So there's no rush. So
No.
over 6 months, she can just do it on the side and then
Yes.
switch over to our entity is covered.
Correct. So what you could do is you could just go through Headway for the time being, have them bill, and you make money. And then in the background, you're getting credentialed, your entity is, and you again through that entity. And then 6 to 12 months from now, if you don't like what Headway's doing, or if you think they're taking too much off the top, you can basically go your own way and you'd be fine.
Okay,
got it.
perfect.
That's really helpful. Thank you.
Yeah, yeah. Well, that piece of advice right there was worth the call. That right there could save you a lot of headaches.
Yeah. No, you're not kidding because that's the fine print right there that nobody goes over with you. So,
Right. How much is Headway taking percentage wise of collections?
oh, it's interesting. The guy, very nice guy, but he was kind of cryptic about it a little bit.
Yeah.
He gave us how much we would make per visit, per whatever.
Can we say
Um,
it?
yeah, I guess. Yeah.
So we get on the call. He says you'd be a 1099. We do all this for you, everything credentialing, billing, and we're like, okay, great. And she knows what she makes right now per hour, and then he was throwing out pretty big numbers, which we thought were big because we know what she's making, and so they were like, our NPs usually are making, if you're billing 30-minute time slots using these CPT codes, which are pretty standard, what she does all day, every day. And they said it's about 350 to 370 an hour. And so I said, of course, well, what's your take? And he goes, no, that's what's left over. So 350 to 370 is what you get. We have our percentage, but he never told me the number.
Yeah, you need to know what percentage that is, because if it's like 10 or 20%, fuck that. You need to be doing it yourself.
Yeah. So I
All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all elite nurse practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and that other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode.
I know I know somebody else who runs their own practice and they kept billing in-house and it felt like a nightmare for just as
Yeah,
an option. and on the outside, I was like, that looks awful.
Okay, yeah, for sure. But listen, if you have a third party medical biller billing for you,
Yeah.
okay, they are going to only charge you between 4 to 7%, depending on who it is. Okay.
Mm.
Yeah. And they handle all the headaches and everything for you. Okay.
Oh,
Now, how
okay.
much is Headway charging? You know what I mean? That's the question. Is it 7%? Is it market? If it's 7%, that's market. Then that's a good deal. It's certainly not a big deal. But if it's
Okay.
10%, 20%, you're paying someone an enormous amount of money to do something that you could have someone else do for a fraction of that cost, and it'd be just as good. Same amount of
Hmm.
money.
Hmm. Okay.
And
Okay.
does that number sound like a good number to you? Like the
I I don't
370?
know. I don't know what code that is. I mean, Megan,
Yep.
I hear from other psych NPs who have a mental health clinic where, if they add some counseling in the visit and medication management, et cetera, they're billing, level 4 visits, and they're adding all these add-on codes and everything. Like, they're getting $200 or $300 a visit.
Mm.
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 You do 2 of
Okay.
those an hour. I mean, it sounds like you might not be getting a good deal here.
Hmm.
Mm.
Okay.
Yeah,
But either
yeah.
way, we get started, like you said, get
Yeah.
started, get this process rolling, because this is a slow rollout. She's not going to leave her job just because we want to see what the market demand is and whatnot. But as we slowly roll into it, we really should be preparing for,
Yeah.
like, phase two would be get off of that and have our own billing and have our own production.
Yeah, and you need to read that contract, and you need to
Mhm.
find out, do you own these patients or does Headway own these patients? If
Hmm.
you split ways with them, will they take your patient census and give it to someone else?
Mm.
Mm. I didn't
If
even know they
that's
could.
if that's in the contract, they can do whatever they want.
Mm. Hmm.
So you sit there and you build this practice, and then you
Yeah.
split ways with them, and they take all the patients, and you can't do a damn thing about it.
Right.
Yeah, that would be really bad.
Yeah, you need to take a look at that contract. I would highly, when you start getting these third party sharks involved, there's all kinds of stuff that they can do to basically rob the NP of money.
Wow. Okay. That's
Yeah,
helpful. That's very
yeah,
helpful.
yeah.
Definitely be reading
So
the contract with a magnifying glass and a lawyer to.
I think it'd be worthwhile.
Mhm. Mhm. Yeah,
Yeah,
and that's helpful to know that there's other third-party billers that don't charge all that much, like market is 7%. That's helpful.
yeah, and that's on the high end. Okay, 7%. You know,
Okay.
a lot of them will charge you I mean, 4% on the low end, but 5-6% seems to be the average. And if you get
Mm.
a good medical billing company, they're
Mm.
gonna do a good job because they don't get paid unless you get paid, right?
Mm.
Right.
Yeah.
Yeah.
And then in
So,
the same vein, uh, do you in your business practice, do you keep a bookkeeper and a CPA? My state's nurse practitioner uh, association just had a board of a panel that they let people sit down on nurse entrepreneurs, and they talked about how they had a team of billers and CPA and bookkeepers and accountants and all that. Is that how you run your practice as well? Do you have a team like that?
I mean, they're just all third party businesses, like, I mean, $1 million business. I just have a bookkeeper through my accountant. I pay him whatever it is a month to do my books for me.
Okay. All right.
Yeah.
So you have a third party bookkeeper, third party CPA guy or girl,
Yeah.
third party, all that other stuff.
Yeah.
Okay.
Yeah. You guys, you too should be able to run the practice yourself basically for a while.
Hmm.
Jamison could be answering the phones, act as kind of the receptionist. You can too when you answer the phone. Like, you guys can really keep this very, very slim and efficient for the first probably 6 to 12 months. And then at that point, you need to be thinking to yourself, okay, where are we spending so much of our time? The busy work, and usually that's going to be more reception kind of stuff, right? But at the start of it, you guys could do that yourself.
Okay.
Yeah.
That's really
We've
helpful.
done that before.
How
Yeah.
do I what's a good time frame? What do you say is a good time frame for a psych or any kind of nurse practitioner business to be up and you should be humming along here? And does it take 2 years or?
Well, I'm just going to give you an average. Okay. Because I've spoke to
Yeah.
hundreds of MPs. I've helped thousands of MPs start their practices. So this is about an average. Okay. Some NPs, they go to zero to $100,000 a month in like 6 months, just insane growth, while others after a year aren't making anything. Okay.
Mm,
So it varies widely, but on average, you could probably expect usually between 2 to 4 months for the business to go on autopilot. All right. That basically just means the business expenses are being covered by the business's revenue. So you're not putting any more of your personal money into it. Right.
okay.
That typically takes between 2 to 4 months. Uh, Usually you don't really start making a whole lot of money, probably for 6 to 12 months, really. At the 12-month mark, after you've been open for a year, you should be making a decent profit to the point where, you know, you're considering leaving your job.
Okay.
Yeah, that
Okay.
was it.
Yeah, like at the 12-month mark, that's when most NPs are like, okay, this is a pivotal moment for me. I'm at the fork in the road, so to speak. Like, do I take the left and continue doing what I'm doing, part-time practice while working full-time or part-time, or do I or do I go right and say, I'm going to just go 100% in on my business at this point and really grow it, you know? So at that point, that's a really hard decision to make. A lot of fear and anxiety typically go into that decision because you have this cushy job that gives you benefits and it's a predictable salary every 2 weeks, et cetera. Right?
Yep.
It's a very, very hard decision. Me personally, I waited way too long. I should have quit my job probably 2 years earlier than what I did, but it was a fear-based kind of thing.
Mm.
Um, but most NPs at that 12-month mark or so, when their business is making, a decent amount of money, most NPs who quit their job and go in on their business, most of them do not regret the decision. They wish they would have done it earlier, and they grow their business 2x in 6 months because now they're
Mm,
focused on their business.
yeah, that makes a lot of
That's a
sense.
good time.
Was there a trait that you saw in the ones that went from 0 to 100,000 in 6 months? Was there a common trait that they had
Yeah.
that you
Yeah.
could yeah.
Delivering the right service to the right population in an area that's unsaturated.
Mm,
That's
okay.
basically it. Like, for example, you open up a weight loss clinic in a town of 20,000. There isn't a weight loss clinic there, and everyone wants semaglutide, and you're the one who delivers that. Right place, right time, right service. You know what I mean? And then
Okay.
sprinkle some luck on it. Really, at the end of the day, there's just, there's just luck involved too at the end of the day. Um, so yeah, but that's the main trait. Or there are others who have done it. I know some people in a very, very large metropolitan area who started a weight loss wellness practice in a large metropolitan area with a lot of competition, a saturated market, and they have $1 million practice in just a year and a half. They separated themselves by spending a lot of money on marketing and just providing a very affordable service. So basically, they undercut all the competition. They undercut them. They provided a cheaper service, but what separated them was that even though it was cheaper, they still excelled from a customer service standpoint.
Yep.
Mm.
Yeah.
So undercutting the market and really great customer service.
Yes. That's it
That's
right there.
That was our model for that little company. Was there was a big dog in town. There's actually two or three, and we were small and we were just lean, and we just great customer service. Money back guarantee, no problem. I'll give you a refund back,
Yep.
and we grew fast.
Yeah, that's it. That's seriously it, guys. If you provide amazing customer service, um, you're gonna do well. It's pretty hard not to,
Mhm.
It's
you
great.
know. Yeah.
Mhm.
How many people have you heard who went to, this doctor down the street or whatever, and everyone hates this guy. The customer service sucks. The doctor's an asshole. The receptionist is a bitch. You know what I mean? Like how many times have you heard that?
Yeah, no, it's true. But they have to keep going because they don't know where else to go.
They don't know where else to go. Exactly. Right. So if you can bring in amazing service at a good price, it's just a matter of time before you start making good money. You know what I mean?
Yeah.
Yeah. Like at this point with my men's health clinic, we provide such good service that I barely spend anything on marketing anymore. It's just
Yeah.
word of mouth at this point, you know?
Yep.
Mm,
And that's the sweet spot there.
yeah.
Yeah.
Then
And
when
then,
do you know? Oh, sorry, go ahead.
and then I was going to say, and if you provide amazing customer service, people then write 5-star Google reviews and stuff for you. And it's a win-win. Then people see that and they, I couldn't tell you how many times people have called our men's health clinic or bought an Elite MP course because I saw your reviews and they were just absolutely amazing. So I decided to pull the trigger.
Yeah.
Awesome.
No, that's really great. And then
Yeah.
when do you know when it's time to bring another, like, let's say I want to bring another nurse practitioner in? Um, is that is that something that you do kind of phase two? Do you think about your business in phases, like phase one, phase two, like
Yeah.
scaling it?
Yeah, for sure. So phase one would be, this is just right off the top of my head here, right? So, phase one would be basically just the initial startup, right? Getting patients in the door, getting your business on autopilot, and making enough money to, either pay yourself for your time or invest back in the business. So that's phase one. Again, that should be 6 to 12 months.
Mhm.
Phase two is going to be at the point where, okay, I'm making decent money now. Phase two is, do I go 100% in the business, quit my job? Um, do I hire staff now? Usually that's going to be more accessory staff. Okay.
Mm,
Yeah. So, a receptionist, for example, right? Or a medical assistant, for example. Most people seem to be able to get away without any employees whatsoever for the first 6 to 12 months. And then they're pulling their hair out at the beginning of phase two because they are doing so much work. They're doing everything. They're being everything for everyone in their business, right? And they just don't have time for themselves. They don't have time to grow their business anymore. You know what I mean?
mhm, mhm.
So they have to hire some help, right? So that's basically like that. That would be phase two, in my opinion, is you hire some help. Okay, now you don't have to be spending so much time on all the busy work. And then you could focus more on the income generating work, seeing patients, marketing, etc. Right. And then at phase three, you're doing all of that. You are so busy now doing income generating work that you no longer have time to start focusing on the business any further, working on the business because you're so busy in the business still doing all that income generating work that phase three is like, okay, now I need to start hiring other income generating people. So that'd be
Right.
like phase three for like, hiring a nurse practitioner. So you're probably a little off for that yet, probably 2 years, but
Yeah.
you never know that you could be at phase three in 12 months.
Mm,
Right.
You
Right.
just, you just don't know until you do it.
yeah. No, that's helpful. That's helpful to think about it in steps like that.
Yeah.
That's helpful.
Yeah. So just be thinking about that. You know what I mean? There's definitely, there's these milestones that you should be hitting, a lot of people want to go in from the start in phase three. I'm going to hire a nurse practitioner. I'm going to have receptionists. I'm going to have all these things. And you're just like,
Mhm.
you're putting a lot of money and a
Mm,
lot of risk into something that's not a proven model yet,
That
right.
is fair.
Right.
That's
you
fair.
know?
Yeah. Like
Yeah,
I like that framework milestones. You're
yeah,
hitting bench as you go.
Yeah.
exactly.
We're
Yep.
That
probably more conservative in how we built the previous business, even building wealth, just slow and steady. And in the end, you win if you make the right steps.
Yeah. Slow and steady, right? Like, don't
no.
be in a rush here. People want to come in and think they're going to make $100,000 a month in 3 months. Like, that doesn't work that way.
No.
you
Mhm.
know?
And it's helpful to hear you say that too, because it's slow going, but it should be steadily increasing 2 to 4 months and then 6 to 12 months and then 12 months to a year. You should be hitting, or 12 months to 2 years, you should be hitting these benchmarks. So, like, oh, you should be growing in this way.
Right.
So,
Right. You're hitting averages. You know what I
right,
mean? You
right.
know, you're in the middle of the bell curve, so to speak. Sure, there's outliers on both sides, right?
Yep.
There's people on that third standard deviation to the left and the right who are, that they're the third standard deviation. They are the 5%. I mean, I've talked to NPs who've been running their practices for 2 or 3 years who still aren't making any money. It's like, what the hell are you doing?
Yeah.
You know, right? That happens to some NPs, and normally it's just bad business. They just don't. There's some people who just aren't meant to be a business owner. You know what I mean? I hate to say that. There's just some people they're just not made for it, you know? And then there's others in the, in the top 5% who just absolutely kill it. And again, a lot of that's luck based and just being at the right place at the right time.
Yeah. No, that's good. So thank you for that framework. That's really helpful.
We're gonna be
So,
at 5%.
That's right.
I hope you guys do. I hope, you mentioned that you wanted to talk about, offering some other services, right?
Yeah.
I think that what guides that is that you have to get on Google Maps and do some market research and determine, what isn't there in your area, right? Like what's not here? What's the service I can bring in here that isn't here yet, right? Like you're bringing a service in an unsaturated area, you know? It's like, for example, when I wanted to open up a Jersey Mike's franchise, there wasn't one in my city. I'm like, I know it'd kill it. I know it would, right? Because there's not one here, and they do well anywhere they open up, right? Anyways, long story short, I wasn't able to get the franchise due to some stupid bullshit. But anyways, someone else is opening it up now, and they're killing it. Pisses me off. But yeah, is what it is, right? But it's the same thing for for you guys. Like, is there someone doing weight loss? Is there someone doing hormone replacement therapy? Is there someone doing vitamin injections, et cetera, right? There isn't someone doing that service in your area, then you need to be the one that brings it in there. If you do that, it's going to exponentially increase your chances for success.
That's helpful.
Okay.
Yeah.
Now, I've been just thinking about, these incorporating different service lines, in this phase 3, phase 4, whatever, a few years from now. And I've been talking to some people, and lo and behold, met someone that we know very well. And I started, kind of pitching this idea. And they said, I would love to join. Oh my gosh, this would be so great. I could help. And I'm like, well, what do you like? And she's like, oh my gosh, I love aesthetics. I would love to do IV therapy. And in my head, I'm going, well, wait a minute. If the market is right, would a good employee or someone that you think would be a great asset to your team, would it be wise to even steer down that road because you have someone who's passionate about it, that wants to build it with us? Would you do that even if it was not something that we necessarily like? Aesthetics, I have no desire. I don't even know if you have any desire to do that, but she does. And I'm, is that something maybe to pursue?
Yeah, I mean, if there's definitely a need for it.
Yeah.
If there's a lot of saturation and things like that, then I don't think I'd put a whole lot of effort and time into it.
Yeah.
Right.
But if you want to bring someone else on board to provide some other services and whatnot and leverage their work, then it kind of gets you in that phase 3 right from the get-go, right?
Yeah.
Right.
And then do you like to do a split, like a whatever 60-40 split, or do you like to do hourly? What do you like? Or I don't know. What's a good split? Why? I don't know.
Yeah. So when you bring an NP in, especially one who's going to start bringing in, their own services and stuff, and start building up their own patient, census and whatnot, they're doing a lot of the work, right? You're just kind of just more or less the administrator there and handling the bullshit they don't want to handle. They don't want to do, right?
Yep.
So generally, 60-40, 60% to the NP, 40% to the business owner. That tends to be on the very high end of it, the very generous end of it. Personally, I would never pay an NP working at my practice 60%. I just wouldn't. It's not worth it to me. I could find someone else to do it a lot cheaper. You know what I mean?
Okay.
Yeah. So with that said, I think 50-50 still is probably a little too generous. I wish all MPs out there made 50% of what they bring into the business. I really do. But as a business owner, I don't want to pay an MP that much money, So 40% seems to be pretty reasonable in my opinion. If you pay someone 40%, that seems to be reasonable. But you could also just pay them a very, just a flat rate.
Yep.
For each new patient, you pay them this amount of money. For follow-ups, you pay them this amount of money. For this procedure, you pay them this amount of money. You just break it down to where they're making between 30-40%, but it's just a flat rate.
Yeah. That's
Yeah.
helpful.
Yeah.
Yeah, that's a good perspective.
A production model is the way to go for sure.
Production model. Yeah.
Yes. Yeah. That way you're not paying someone hourly to sit there and, play on their phone.
No, I totally agree.
Yeah.
Like, especially bonuses and just having upfront, with this amount of new patients or this amount of growth, we'll give you this bonus.
Exactly.
Keep people engaged.
Okay.
Exactly.
Yeah.
Exactly. Receptionists and whatnot, you pay those people hourly, right? And if you're open, let's just say, 9 to 5, and there's 2 hours in the afternoon between, I don't know, 1 and 3, where there's no calls, there's no patients or anything, you're still paying that person for those 2 hours that they did nothing, right?
Yeah.
That's just part of being a business owner. That's just how it is, right? But with
Mhm.
an NP or a provider or an income generating person, if you pay them production, then that high rate of pay is not a risk for you as the business owner because it's only production.
Yeah. No,
So if
that's
they, yeah. So
helpful there. Just a couple more questions, if we could.
yeah, for sure.
One, most of this is going to be telehealth at the beginning because I don't have a brick and mortar to go to. And 90% of my practice currently in my job is telehealth. So thinking that that's going to be the main kind of bread and butter, I was thinking of doing Doxy or something, unless you know of a better telepsych platform to use.
Your EMR is going to have that functionality in it.
Okay. All right. Just use that. Yeah.
Yeah. Just use that. That way it's right there on your calendar. You just click it and you start the video chat or whatever. You know what I mean?
Very good. Thank you.
Yeah.
And um, this is also kind of random, but I was thinking about how, if I'm a solo practitioner, how do I take time off? In psychiatry, it's not like the emergency room or like a medical practice where it's normal 9 to 5 hours. And if you hurt yourself or you have a medical question, you wait till opening hours or you go to an urgent care clinic. It tends to seem that in psychiatry, there's this expectation that you're available all the time. Um, and I'm just wondering, how would I take any time off if I'm just by myself? I don't have any covering provider because I'm in a full practice state. So I don't need a covering
Right.
physician. I don't know if you've
Well,
asked that.
yeah. So, as a business owner, there's really no such thing as a vacation.
Mm,
There just really isn't. Not until the business is just completely working for you. Okay.
mm,
You're not in that phase yet. That's like phase 4. Okay.
mm,
That's like you have an MP working for you. You have 2 of them. Everything is streamlined. You could literally walk away and your business still runs itself and you don't have to
mm,
put any input into it. Right. That's
mm.
more like that's phase 4. That's kind of the final phase. Well, the final phase is selling it. Right. But
Yeah.
yeah, but you know, you're not going to be able to just take a vacation and not think about your business for a couple years, probably. All right.
Okay.
That's just the sacrifice that you make as a business owner, right?
Mm,
But that's why you also have the opportunity to make the big bucks because you're making those sacrifices when a lot of people refuse to, right?
yeah.
Yeah. I was on my honeymoon and I was answering emails for Elite NP and still putting fires out through text with my men's health clinic, right? Like, I'm sitting on the beach in St. Lucia on my phone texting over shit that needed to be taken care of, right?
Yep.
That's just part of it. It's an unfortunate reality, but you can get out of there. You can get out of that by, hiring other people to, run the business for you. But to answer your question directly in terms of, on call or whatever, I would set boundaries very specifically with your patients about, you cannot call me after this time. If you have to call me for anything after this time, it's an emergency. You need to go to the ER, right?
Okay. Yeah.
Shut your damn phone off,
Yeah.
right?
Yeah.
So you have to just have some boundaries here. There's just no way around it. You have to tell your patients, these are the boundaries. You can't be calling me at 11 o'clock at night because you can't sleep. You think you need a dose adjustment. Come on, that can wait till tomorrow.
Right.
Yeah. Or they're having a panic attack or something. If it's that bad, go to the ER, right? Um, I learned very, very quickly at my men's health clinic that 6 o'clock or something came around. I just shut my phone off.
Mm,
I just shut it off. You know,
yeah.
the
Yeah.
voicemail says this is a medical emergency. Go to the ER. This is an urgent need. Go to an urgent care. If
Yeah.
not, wait till tomorrow and give us a call. Like,
Yeah. Yeah.
yeah,
Yeah. And then they can also, do you let your patients email you? Do they have like an email portal or something? Or
yeah, they can message you through the EMR typically.
okay, right, yeah, that's good.
Yeah. 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 So that's where that's part of the boundary, right? Like you can't call, send us a message through the EMR. We'll get back to you within 24 hours or 12 hours or whatever.
Yeah. Okay.
Yeah.
Yeah,
Yeah.
that's helpful.
Yeah. Now, in terms of like a vacation though,
Yes.
you can set it up in a way to where, all right, we're going to take a week off. We're going to take 10 days off. Receptionists, everyone, we are closing for 1 week. You
Mm,
put a voicemail. We are closed between this date and that date. Please leave a message if you're a new patient interested in scheduling a visit or whatever. If this is a medical emergency, blah, 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 blah. If this is if you need a refill or whatever, please message us through the clinical portal. And then when you're on vacation, you can just you know, 5 o'clock in the morning, you wake up and you just get a little bit of work done for 30, 45 minutes. You take care of all that stuff. And then you go about your day.
hmm. That's helpful. I like that. Yeah, that if you want to take some time off, then they can message me through the portal, and then I can just do basic things like refills. I'm not doing any med adjustments. I'm not
Right.
There,
managing crisis or anything. But
Right.
yeah,
Exactly.
I do
Exactly.
or things like that from wherever I am.
Yeah.
So
The first year I was open at my men's health clinic, actually the first 2 years, it was just me and my medical assistant. Like that was it.
yep.
And, we were both just like, man, we need to take a damn vacation. So we closed. We just closed for a week. We put a sign on the door. We changed the voicemail and we didn't even fool with it. We were like, whatever it is, it can wait.
Yep. Yeah. No, that's good. That's helpful. Only because I want to make to the legal point earlier, I want to make sure that I'm not missing something, or legally I could be sued because I wasn't available at such and such whatever. So as long as the voicemail says that and they have access through the portal, then that's fine.
Right, 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 exactly.
Because I'm
Or you can develop a relationship as well with maybe another office or something, you know.
yeah.
Hey, you guys, for $500 or $1,000 or whatever this week, can you know, deal with any urgent needs from any of our patients or something? I mean, you could do that too.
Yeah, no, that's a good idea too. Like just collaborate with another NP out here.
they probably want vacation too.
Yeah.
Right,
Yeah.
exactly. There you go. That's a good point, Jameson. Like, you scratch my back, I'll scratch yours when you need it.
That's,
Yeah.
that's right.
Yeah.
It doesn't even need to be anything official. It's just like a
Handshake kind of thing.
Yeah,
yeah.
exactly. Yeah.
Yeah,
Okay.
yeah. So, any other
Hmm.
questions?
I don't. That was really helpful. Thank
I have
you.
100.
Oh, but
I
we
love the men's
we'll
health
do
clinic
we can
idea,
part two sometime.
and I wanted to ask about the, what is it,
Yeah.
semaglutide,
Yeah.
semaglutide, and then you
Yeah.
said a compounding pharmacy. I mean, I believe you have a course on that, but is that something like she can jump into? I mean, we what do you need to have on staff to start that?
Yeah, I mean, you could definitely do it. She just has to prescribe it for a mental health need. That's just kind of what makes it a little bit difficult.
Yep.
Um, you just can't advertise it as just a straight up weight loss clinic. Um,
Yeah.
you have to advertise it more or less as, is your obesity or whatever, is it affecting your mood? Are you depressed because, you're obese or whatever? Then call us. You could do it that way. But
Okay.
for someone who just wants to lose 20 pounds so they can fit in their wedding dress, you can't really treat that patient.
Yeah. No, that's good. that kind of circles back to what we had talked about earlier. So that's helpful.
Yeah. If you guys want to do that, like Jamison, if you really want to do that, if you guys find that there is a real need in your area for men's health, IV infusion, weight loss, whatever it is, there's a real need for it, then you can, if you have some cash on hand, you could go that route and hire an NP to be there, on a very part-time basis where they just see patients once a week. You could, you could start off that way if you wanted to.
Yeah. Yeah. We have a good friend who's a nurse practitioner, family nurse practitioner, who would be good for that. So we've thought about it. Yeah.
There you go. It might be worth the conversation.
Yeah.
Yeah, for sure.
Yeah. So, yeah. Any other questions?
I don't think so.
That's it.
That was really helpful. Thank you so much for your time.
Cool. Absolutely. Well, listen, if you guys want to do a follow-up, 6 to 12 months from now, I would really love to know kind of, where you guys are at and what's going on. So, you have my email, so, reach out to me, and I would like to, see where you're at, what phase you're in, and how things are going.
Yeah, for sure. Definitely will do. Thank you.
Cool. Yeah. You guys are welcome. I like to end the episodes with you asking me a question, a personal question, a curiosity or anything. You guys have any questions for me?
Yeah. Well, first, I just want to congratulate you on all your success. Really, you're doing such a great job. And I really want to thank you for the way that you inspire all of us out here that we can do that too. So I just wanted to say thank you for that.
A pleasure.
And yeah. And, just wondering if there was any mistakes that you made along the way, that maybe pitfalls or mistakes that you would caution us against.
I think the biggest one that applies to you guys here, there's probably, dozens of these regrets and stuff, right? Like, I mentioned one of them earlier. Like, I wish I would have quit my job earlier, like I wish I would have started my practice, years earlier, there's all kinds of things like that. But I think one that really applies to you guys is that, signing contracts with third parties. I've done it myself, where you sign this contract with someone, and you didn't truly understand what you were signing, and come to find out, shit, like, I'm stuck in this now, and I have to deal with this until the contract expires, or I have to buy my way out of it. That's happened to me multiple times. Marketing agencies, lawyers, various things. Okay. And it sucks. It's a complete waste of money. Right. So for you guys, I think that's going to be probably one of the biggest regrets that I had. That's going to be more applicable to your situation. I think that you guys really need to review that contract that you have, and you need to make sure that you're not doing something that's really just going to put you in handcuffs for a while.
Yeah. No, that is very good. I wrote a ton of notes when you were talking about that earlier, about going through that with a fine tooth comb. So thank you.
You're welcome. Yeah. Get good at reading contracts and legal documents and stuff as a business owner. Seriously, just get good at that. Yeah.
Yep. I'm going to do it.
For sure. So cool. All right, good question. So anyways, listen, I appreciate your guys' time. I hope this helped. And, let me know if you guys ever want to do a follow-up.
Yeah. Helped a ton. Thanks so much.
So, all right, you guys are welcome.
All right. Take care.
All right, bye. All right, I hope everyone enjoyed the episode with Megan and Jamison. They're going to open up a integrative mental health clinic. In all reality, a clinic like that, it's a pretty easy win. There's a big demand for it, especially if you're accepting insurance. So they should do well. I think one of the big things, though, you guys need to walk away with this is that, two things. Number one is be very, very, very cautious on what you are signing with a third party or a middleman. There's lots of sharks out there in this world that love to prey on new business owners and love to take money from your work, okay? You need to be cautious. You're starting a business because you want the independence and you want the freedom. And if you get trapped in something like that, that's not what you're going to have, okay? So be very, very cautious in what you are signing, understand the specifics, and understand the ways that you can get out. And then the other thing is the phases of your business, okay? Those phases that I talked about over the episode. that's just a general rule of thumb. Okay. That's kind of the evolution of a business, so to speak. Okay. You're going to hit those phases, those milestones at different rates. Many of you listening to me already have a practice. Maybe you're in phase 2, phase 3 is on the way, then you got phase 4 where you're not working in the business anymore. And then phase 5 is eventually selling it, right? Everyone's going to be at different phases. So just keep that in mind. Don't get down on yourself if you are hitting it a little bit slower than compared to others. Okay, so don't get down on yourself. That's just business. You never know, and everyone gets to different phases at different times. Bye. Hope everyone enjoys this episode. Talk to you later. Bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcasts. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.